Hi, I'm Ben Bain, chiropractor here at Madrid Health. I want to use this short video to explain an ideal seated position, especially when you're working many hours at a desk, as well as an ideal sleeping position and how to take stress off the spine and especially in the low back and the neck. So when we're seated, normally we have a comfortable seat. We're lucky if we have a good desk chair and we have a lumbar support. But normally over several hours, we tend to get more into this position. We're hunched over, our curve in our neck is coming forward. Your head weighs about 4 kilos. So we start doubling the weight of the head on these lower joints. That creates stress. It actually does micro tears in the ligament tissue that supports the upper muscle tissue over repetitive time, for example, days, months, sometimes years. That causes this area to rip slightly, and then we get even more muscle strain on the area, as well as making the area more sensitive. The low back, when in that position, moves forward, so then ultimately it causes more load from our body pushing down the low back. That's more pressure and stress on the sciatic nerve affecting down the legs. So a good way of doing it, I'm using a rolled up towel here to demonstrate, which actually is fine to use. On Amazon, you can get these really cheap. If you put in lumbar support, they're like 10 euros, but ultimately it's something that creates more curve in the low back and more lordosis. So if I put that into the low back here and I'm pressed against it, immediately my shoulder blades come further back. I can keep my head tilted at an optimum position. So if I'm working on a computer, I'm upright. The key part is putting a low back support. I'm not a fan of like posture braces that do this to your spine, but with something in the low back, your mid back, like a reflex reaction, will immediately come further back, and that keeps us in a good position. If you have a lot of low back pain, a lot of sciatica, it's really worthwhile to put something on the floor. That could be a cushion, a pillow, even 2 books. I'm using a leg support here. If I place my legs on that, because I got them slightly raised, I've got less pressure on the sciatic nerve and less pressure on the sacrum and the pelvis. So I'm in a good position there, especially if I'm suffering from sciatica, disc herniation, or even horrendous neck pain. That's a good ideal seated position. I'm now going to demonstrate 2 tips that can really assist with ideal sleeping position. I'm going to pretend this is a bed. It's more comfortable than it looks. So we're going to lie down. If I want to be face up, and especially if I've got a lot of sciatica pain down the leg or a disc herniation, we need to raise the lower legs very slightly so we have less pressure on those nerves that control from here down the leg. So if I'm lying face up, I can place this on my lower calf muscles. So we can use, for example, a thin pillow, a cushion, something that for 1 inch or 2 inches is going to slightly raise up below the knee. So if I'm lying down, I'm in that position, I have that raised up, I have less pressure onto my low back and down the legs. I can also, if I'm going onto my side, I can also do that from a side position, like this, for example, not rotating the shoulder too forward. That's good support, especially for sciatica pain down the leg. However, if we have a lot of low back pain, pelvic pain, it's also worthwhile to place something here between the legs, so it stops it rotating forward, because when we rotate like this, we have more pressure on the nerves coming down. So I'm going to take this. Again, we can use another pillow or rolled up towel as I'm using here. I can then place that between the legs. So I've got my lower legs raised slightly, and I also have this between the legs, and that will take all the tension off the low back and the pelvis. That assists sleeping position, especially getting more comfortable for the low back. Okay, so in chiropractic, our main goal is to get your joints and your nervous system functioning better, functioning optimally. That's where chiropractic is very unique and very different from other treatments like physiotherapy, massage, acupuncture. Our goal with anything to do with chiropractic is to adjust the joints and take that pressure off the area. The healing takes place later the same night, the next day, sometimes the next 2-3 days, immediately after an adjustment. It's not always instant. It's a bit like when we do a course of antibiotics for the first time. It can be up and down at first because it's a process to get everything moving better. That's why I often say to people, it's a bit like a vaccine the first time. It's a shock to the joints and nervous system. Your body needs to recover from that, and that's why it does the recovery at night when we're sleeping. So my goal with a lot of patients that we see is always to get them sleeping better, because when you're sleeping deep, you're going to be healing better. So especially when we're dealing with joints, for example, in C6, C7, that controls down the upper back, down the arm into the hand, our goal is to get restoration in the curve here, increase the movement here between the joints, so that between the joints, the tendons here are free, the muscles free, and the nerves free. And that's when you start standing straighter and feeling better. Same for the low back here. Majority of people always have problems L4-5 because this is right down the base of the spine. And with problems on L5, we get more tilt in the spine, we get pain down the leg, into the pelvis. So we adjust, we push into that area, because when we do that, we create movement, less pressure on the nerves and the muscle tissue. We need repetition to do that at first, because if you imagine it's been like that for years, that's years of bad memories in the tendons, the ligaments, the muscle tissue, where a bit like glue, it's all stuck together. So when we adjust, what we're essentially doing is causing an alteration in the joint receptors to create movement. And that allows everything to breathe. But your body's not used to that, so it fights us and goes back to where it was again initially, because it's a bit like brace on the teeth, it's used to that position. But each time we adjust you, because we stimulate receptors, they remember, and it moves more at that time than back less. That's why as we progress, you feel better and better, and then the pain gets less and less as we work through that problem. A lot of people, when they see us, might have seen videos of manipulation, chiropractors online, YouTube, our good YouTube channel as well, and they're wondering, what is that cracking sound? What's that big pop? Nothing's actually cracking, nothing's breaking, there's nothing painful associated with an adjustment. When we adjust your joints, because it's a very specific movement when it's done correct, but ultimately when we adjust the joints and we create movement, little nitric oxide gas bubbles push into the area, and that causes like a vacuum. And as that vacuum expands, it pops out, and that creates a popping sound. So that popping sound is nothing cracking, there's nothing like bone on bone. It's associated with relief because it's such a specific fast movement that the release can often cause a sound. Sometimes with adjustments, for example, machine-assisted adjustments, you won't hear a cracking, but we're still stimulating the joint into place. It's all about creating joint movement. Rest assured, everything we do is to create relief, and we do everything possible to help you. As a chiropractor, one of the most powerful things I can do is adjust and create movement in the top two vertebrae of your body. In C1-2 here, we have over 80% of your entire nervous system and all the functioning that controls down the spine, the functioning into our head, the functioning into your sleep pattern, posture comes from the top two joints. So it's an area where people aren't sleeping good, they're tired, low energy, sometimes blurred vision. It's a very effective way to adjust because it also affects the vagus nerve here from C1-2, which is very important in what's called our parasympathetic nervous system. So when you adjust here, you can influence everything coming down. So it's one of my favorite adjustments because admittedly the majority of people when they first come here are not sleeping good. They have bad energy, their head's like this, and they're feeling stressed. And it's a good way to stimulate endorphins, the good hormone response as well, when you adjust in C1-2 here and create a nice reflex, relaxing action down the spine. It's one of my favorite adjustments to do is C1-2. I really hope these tips help you. They're daily tips that can make a big difference in our daily life, especially for long-term discomfort. Any questions, please feel free to contact us, message us on WhatsApp, and I look forward to seeing you soon. Thank you.